Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is September 25th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have nearly 33 million cases and over 990,000 deaths. In the United States, we have over 7.2 million cases and over 208,000 deaths. Some of the biggest news this week is that the CDC posted an update on their website indicating that airborne transmission for the virus was a thing. Unfortunately, they took that down shortly after having it up and said that it was an editing mistake. It's still unclear why they didn't just leave it up, since there is growing evidence that airborne transmission is happening. I and many other health professionals believe that the reason that they took it down is just because they're being cautious. Even though there is a lot of evidence that airborne transmission is happening, and we've talked about that in previous reports, there just hasn't been a definitive study that gives us an exact idea of how big a part airborne transmission plays in the spread of COVID-19. Also, there isn't that much to change about what we need to do, whether it's airborne transmission or just respiratory droplets. We still need to practice social distancing. We still need to wear face masks. We still need to wash our hands. We still need to be in small gatherings, not large gatherings. And we still need to be outdoors more than indoors. One change that may be beneficial for an airborne transmission situation would be to improve circulation in buildings. Most households aren't able to change much in that area, though possibly something that may help would be purchasing an air purifier. The CDC did say that they are still studying the evidence for airborne transmission and will update their website in the near future. One more bit of evidence for airborne transmission are two studies released this week. Researchers used contact tracing to establish how people got sick on two flights. They were able to rule out other sources and determine those flights were the only places that all of those people could have gotten the virus that causes COVID-19. The flights were early in the pandemic, so there wasn't any of the seats being staggered or spread out or anything like that, and people were not typically wearing face masks at that point. But based on where the people who got sick were sitting in the plane, it's very unlikely that it was caused just by respiratory droplets or physical contact with another person or another object that someone else held. Airborne transmission was the most likely source for the spread. Virus numbers are starting to climb again throughout the world. As we talked about last week, Europe is experiencing a second wave, and many areas of the United States that had low numbers before are now increasing. Much of the blame for this surge is being placed on the return to school, whether it be elementary, high school, or college, but we also know that much of it was caused by Labor Day and other end-of-summer activities. Public health experts warn that this fall could be really bad for COVID-19 for a number of reasons, including being inside more and having the flu season running at the same time. Another big possible cause of trouble this fall is the wildfires that are still burning throughout the western United States. Scientists have studied the effect of wildfire smoke on the severity of flu symptoms in previous years, and they've found that the years with the most wildfires and the worst pollution from those wildfires, those are the years that the flu symptoms were the worst. Higher hospitalizations, people getting worse flu than typical, things like that. They believe that people's lungs and throats become weakened from the smoke, which makes the flu symptoms more pronounced and makes hospitalizations more probable. Since COVID-19 is primarily a respiratory disease, we can most likely expect to see the same pattern this year. So please stay away from the wildfire smoke as much as possible. Stay inside, use an air purifier. If you must go outside on days when the pollution is bad, try not to do anything too strenuous that would cause your lungs to have trouble keeping up. If you have access to an N95 mask, please use it. If you don't have an N95 mask, still use either a surgical or a cloth mask, especially for COVID-19, but it may also help some with the smoke. Not as much as an N95 mask, unfortunately. There have been some new studies that are showing that surgical masks, at least, may help with smoke more than was previously thought, but still not anywhere near an N95 mask level of protection. The CDC has posted guidelines for the upcoming Halloween holiday. The link to their guidelines is below the video. You can check out everything that they mentioned there. But in short, they suggest avoiding going door to door for trick-or-treating, and especially avoid closer situations like a trunk-or-treating where everybody is just in a parking lot or something like that. That would be even closer to other people who may have the virus. It would be more easily spread that way. Any parties that may be held should be just small gatherings, and if at all possible, hold them outside, not inside an enclosed space. If you want to hand out candy or treats, the best way to do it, they say, is to have a separate bag or other container filled with treats or whatever, and just place them out on the sidewalk or some other area in your front yard where the kids can come and just grab a container or a bag themselves without you having to touch it, then give it to them, etc. Basically, the fewer points of contact, the better. Along with that, make sure that if you are doing that and creating those goodie bags, make sure that you wash your hands before putting those together. Speaking of candy, a man died from eating too much licorice. It happened last year, but doctors only determined this past week that the licorice is what killed him. Licorice has a specific acid in it that in small quantities is totally fine, but in large quantities it can raise blood pressure, cause irregular heart rhythms, and drastically change the body's balance of electrolytes. This man was an extreme case because he ate 1.5 bags of licorice candy each day for a few weeks in a row before his death. But doctors warn that because licorice or licorice root extract is a common ingredient in many foods, drinks, and supplements, many people could possibly be getting too much of that acid in their body without realizing it. Again, you're not likely to die from the small amounts you get every day or every few days, but just kind of keep an eye on it. If you're tempted to go and eat a whole bag or two of licorice, yeah, probably not. Probably don't do that. Probably not safe. So we'll end our report this week with 2 warnings. One we've talked about in the past already. The CDC has reiterated their warning about Salmonella in backyard poultry. So if you raise chickens, ducks, turkeys, any other poultry, please remember they are not pets. Do not snuggle them or kiss them. They might be cute and fluffy, but they can make you sick. Please wash your hands whenever you're around them, handle their eggs carefully, take all the necessary steps to keep yourself from getting sick with Salmonella. The second warning comes from the FDA. Apparently there is a new TikTok challenge involving Benadryl. This shouldn't need to be said, but unfortunately, I guess I do need to say it. Don't take Benadryl unless you absolutely need it. That goes for any drug. Also, for Benadryl or any other drug, when you take it, don't take more than the recommended dose. Benadryl specifically, if you take too much of it, it can lead to seizures, serious heart problems, coma, and even death. So just don't do it. Generally speaking, if a social media challenge tells you to take some sort of drug or medication, it's usually a better idea just to skip that challenge. Just don't do it. It's much safer just to not do that. So thank you for watching the Plain English Public Health Weekly Report for September 25th, 2020. I'm Richard Greenland, and you have a healthy weekend.